Introducing myself, I'm Prabhdeep. I'm professor and chair at the IISc Center for Public Health, and I will be moderating the panel today. My background, I'm a physician and an epidemiologist. I've extensively worked in chronic diseases and part of the Longevity India research group at Indian Institute of Science. I'm very happy to introduce two of my colleagues here who are very passionate about healthy aging and elderly care. So, Mr. Rajeev Sadanandan, I think doesn't require introduction. A lot of people know him already. He was a former health secretary, government of Kerala. And during his tenure, he introduced several very innovative initiatives for chronic diseases as well as to promote healthy aging and elderly care. He's still very active and instrumental as a citizen and as what should I say, a retired expert in this space and continues to significantly contribute to the policy dialogue as well as designing newer initiatives. I'm also happy to introduce Pavithra Reddy, who is again someone really passionate about this field. She works with Vayah Vikas, which is a non-profit dedicated to improving the well-being of elderly. Their work is quite broad, and I think, Pavitra, I will let you tell a little more about your organization when we begin. But broadly, her role, she represents in this panel, she represents the nonprofit sector and also the community. I think maybe I represent more of academia, and Rajiv sir represents policy, bureaucracy, and also nowadays he says, I want to be called as a citizen. I'd want to be representing the citizen. So I think he also is going to be filling several shoes today. So let's get started without wasting any further time. Why are we even doing this webinar today? I think we all know that life expectancy has been increasing in India ever since we became independent. If you look at in the last 50 to 60 years, there have been dramatic advances in the health, both in terms of reducing the mortality and also ensuring that people who have illnesses are able to get treatment and live longer. And hence we have a very a positive outlook in terms of increasing life expectancy. Now, the question is whether lifespan and health span go together. And do we need to do something to ensure that people are not just living longer, but also living healthy and are able to live to the best of their potential and continue to contribute to their family and society in meaningful ways? And hence this discussion today. Now, this is not just an individual level issue. I think this is a societal issue. It is a policy issue. And it is also an issue for health systems broadly, as they need to adapt to a population which is living longer. So if you look at many of us who trained in medicine or who worked in the healthcare over last 20, 25 years, in our early years, we were predominantly focusing on infectious disease control and reducing deaths for infants and also maternal deaths. And those have really been big agendas for the government programs and policies. However, in the last 10 years or so, I think there is an increasing recognition that we need to shift our focus, but it's not so simple and straightforward. And I think today our discussion will delve into many nuances around this whole complex issue of healthy aging. So let me begin with my first question, which is really to look at the big picture. So how should we look at healthy aging just beyond increasing the lifespan? We know that number of years we are living, it's increasing, fine. But what is that we should really be measuring? How do we know that the health span is increasing? How do we know that there are other parameters such as functional independence and also just being a more productive human being? So how do we measure all of this? And what is that governments should look at? What is it that we as researchers should look at or practitioners should look at. Over to you, Rajeev sir, to first get going, and then Pavithra to add on. Over to you.
Thank you, Prabhdeep, and thank you for inviting me to this. You also forgot to mention that I'm a member of the community. I'm a senior citizen myself. So I think that should also be acknowledged as part of my
So
what
you
I
have
can
very high
contribute.
stakes in this discussion.
Yeah. No,
Yes.
there I kind of disagree with you partly because one of the mistakes I think people in the aging space make is that healthy aging doesn't start for seniors. In fact, by that
It should
time,
start.
the horse is
Yes.
almost out of the stable, and I think that's a major reorientation that needs to happen. I've been arguing that preparing for aging starts actually at school or even before because your habits of exercise, not initiating smoking, all this start at the school level. In fact, I've often argued that healthy aging is not very different from healthy living because when you look at most of the parameters that matter to an aged person, they also matter to younger people. Only thing is that the values have kind of changed. Now, coming to the question that you asked, that is, how do you define? In fact, I would, as continuing in the strain that I've been following, I would say we'll need to look at different levels. In fact, there are different levels of aging: the young age, the middle age, and the old elderly age, the really aged people, and the crucial mindset that has to change is that if your longevity has gone up, that is the lifespan has gone up, then shouldn't your benchmarking for the age also change? Because I've been arguing that aging is primarily the responsibility of the individual concerned. That is, it's not for me to say, look, the society should take care of me, my family should take care of me. Primarily, it is my responsibility to realize that I'm going to get aged. I need to have my financial protection. I need to have my health parameters and so on. So if you're looking at from the point of view of people who are really aged, and I guess that is a spirit that you're asking and how it is measured. Ultimately, it is measured by the degree to which you are able to maintain your functionality and your well-being. I think that would be the and normally it is described on three parameters, which is the physical, which includes the locomotive, sensory, and vitality, the cognitive, and social interaction. In fact, I've shared this before also. When elderly in an informal survey in Kerala were asked, what is your biggest problem? What they said was loneliness. But interestingly, in that village, the number of people who reported they were lonely, if they could have come together, that would have been an excellent group. So, which again brings us to another issue. Aging, while it is important for individuals, it's also important to have community structures that can support them. I'd also like to add one more level, which is not seen in the Western literature, which is a spiritual dimension. Now, I'm not talking about religious spirit. Now, when you age, your goals have kind of been met. Your children are settled. You've done everything. One of the major problems that the aged person is going to face is the question of what do I do? Why am I here? What more do I need to do? So having that higher realization to which my functioning is linked is also, I think, very important. Now, to answer your specific question, there are excellent parameters like the ICOPE, standards by WHO and so on, which are fairly detailed. And if you want, we can go through that later. But this is the point I wanted to make, that ultimately it's all about functional well-being on a few dimensions. Thank you.
Fantastic. I think you've really given a very, very, broad approach. And I think our discussion will definitely delve into a very broader perspective, and completely agree with you that it has to start early. And I did not mean only elderly. I actually meant that um, when we look at healthy aging, because life expectancy has increased, all the more important that we need to start thinking about it early. So that's the context I meant. And so that moves on to sort of the natural next question, Pavithra. Let me articulate the question, but you please feel free to also sort of contribute to what we already asked Rajeev sir, and also tell us a little bit about your organization. So I think broadly, what I wanted to understand your perspective on how do we measure all of this? So right now, what happens is we are sort of, we have this concept of monitoring health, right? And it's very much disease perspective. Like we want to measure certain things because we feel, okay, these are the diseases people may get, and hence we check for those diseases, right? But how, if we want to really promote healthy aging, and as I completely agree with Rajeev sir, that we actually need to start working with people much earlier, then what is that we should start measuring in terms of lifestyle, in terms of biomarkers, or in terms of, how do we tell people that, okay, these parameters is what you should work on, and that may help you, let's say, be a healthier person as you grow older. So over to you.
Yeah, thank you, Prabhdeep. And I think Rajeev sir covered almost every point that I wanted to make. So I need to think more now to come up with more points to cover for this. But yeah, Vayah Vikas is a little bit about Vayah Vikas. We are a 4.5-year-old organization. We work primarily with person 60 and above. We call them senior citizens because that's how the government of India refers to a senior citizen as 60 and above. I would like to call that about, change it to 80, but I'm taking the government standards here. And yeah, so our primary goal is to keep somebody over 60 very active and engaged, because that is like a preventiveness for your health and longevity itself. Unless you're active, unless you're engaged mentally and physically, you're going to age faster than others. And I think when we talk about what you were talking about, biomarkers and everything, we do have a lot of biomarkers on physical ailments, right? I think when it's somebody above 60, we should start looking at terms of their isolation. What is the community they have? What is the kind of time they spend? Maybe on gait, because a lot of people have issues when they're walking. What it could also be because they can't see properly, they're not able to walk properly. We are not measuring that. Issues on balance, how well do they sleep? You hear most of the seniors say, I sleep at 11 o'clock and I'm up by 3 o'clock, 4 o'clock in the morning. I can't sleep beyond that point. So does sleep play a role in it? Does gait play a role in it? Maybe these are measurements. Are you single person living alone? There are so many cases because we interact with so many senior citizens. As an example, I can give you whether this man was a highly very busy individual who was a general manager who retired at 62. His kids were outside. He lost his wife like 4 years before his retirement. And when he retired at 62, when I met him, I think I was 67, 68, around that age, he looked like somebody who was in his late 70s or 80s. Not because he had any physical ailments, generally because he was alone. So he was not taking care of himself as such. So is his lifespan longer? Yes. But is he healthy in terms of, again, not physical ailments, but how he interacts with others, what he's doing on a daily routine? I think those are the things that we should be looking at when we start measuring things. Yes, science is important. We do have to measure the other biomarkers, but also these kind of issues that go under the carpet. He's alone as the kids come once in 6 months, or they have a weekly call, but on a daily basis, there's nobody to talk to him. That itself becomes an issue by itself. In India, we are still in the crossroads between treating aging or an older person as a family issue We're still calling a nuclear family, and we're still saying we're in a joint family system. It's changing, but we're caught between the two. Are older persons still expecting their children to take care of them when they get old? Yes, I think people in 70s and above are still expecting that. The young, old, like Rajeev sir said, the 60 plus, the people in the 55 plus have started to think about living on their own. They don't want to stay with their kids, but the others are. So in between this, there are, because of this, I think there are a lot of gaps that need to be filled in understanding an individual and understanding the society as such, and see what we need to do to fill in these gaps.
Excellent. I think you have really sort of expanded the how we need to view this whole issue, right? We can't just look at only physical, but I think what you're saying is social, mental, and as sir already said, spiritual. We need to really look at more holistically rather than saying that, okay, you check your blood pressure. So all of that might be normal, blood pressure, blood sugar, or let's say, your weight is normal, and that doesn't mean you are really going to enhance your health span. I think that's what you're trying to say. So our measurements need to change, and whether we do it as families or whether we do it as primary care or public health system, but we need to measure different things. And I think it's going to be a very big challenge because we are also already struggling to measure even the basic biological and health parameters. Which anyway we should have figured out by now, but unfortunately we are still struggling to do it for a large proportion of population and even manage those parameters well. And here we have the new challenges. So let me switch back to you, sir, that you, in your experience, you have extensively worked in strengthening primary care in Kerala, but I think you've also worked with other sort of health initiatives all over India. So, how do you feel that now the primary health care or the community health approach should be tailored to deal with this new challenge? Because we know that our primary care still is very maternal child care, infectious disease centric. And in the recent time, we are a little bit thinking about chronic disease, but again, not very effective in that space. But yeah, some thinking is coming in. But it's not like we can wait for another 50 years and then say, okay, no, after 50 years, now we'll start thinking about elderly or healthy aging, right? We don't have, because everything is happening at the same time. Like, we talk about, on one hand, we have um, this whole, populations which are still struggling to access basic healthcare. And on the other hand, we have populations which are aging, and we cannot really sort of isolate, right? We have to address diverse challenges at the same time, which is very different from some of the Western countries where this evolution happened over a longer period of time and gave more time for the health system to adapt. So, would you like to share your experiences or thoughts on what adaptation and how these adaptations should be done in the primary care? Over to you.
I think you're raising a question that actually goes to almost the definition of what should primary care be. The textbook definition of that we all learned was that the primary care team is expected to take care of all the health needs of the population, including promotive, preventive, rehabilitative, palliative, and life course, what have you. The definition was so comprehensive that very little of it actually gets done. Now, in fact, these days I work with the primary health center in my village, and we found that the job description for them is so unclear and so vast that ultimately nothing was, not nothing, but only a certain bit of work was being done. So one of the questions that we asked them was, what are the priority areas that we should work on? In spite of our prompting, aging did not figure anywhere there, but palliative care did. Palliative care was came out as very strong commitment, and actually they're doing excellent work over there. Now the question is that in an ideal situation of a primary care, one, we would be taking care of the population right from the last menstrual period till the respectful death. That is the whole gamut, the life course that we're supposed to take care of. And we know that that is not happening. Why is it not happening? Because at the policy level, it has not become important at all. To some extent, I attribute that, at least with regard to aging, I attribute to the high discount of the future that as an Indian society we do. We believe the future is, you can talk about the future, but that may not be as bad as it might be, Now, so that unwillingness to discount the, eagerness to discount the future at a very high rate ensures that we don't invest in managing things in the future. Now, take the case of Kerala. Kerala should have taken care of their non-communicable diseases as part of the primary care in the 90s. We didn't do it, still we don't do it, but we're paying for that now. Such a huge burden of hypertension, diabetes, and now the end organ damage is coming up. There's also the time that we should actually be thinking of how we're going to manage our population going forward. Unfortunately, as I mentioned, to some extent, we're taking care of the hypertension, diabetes after they've been screened. And we're also taking care of the other end of the spectrum, which is palliative care. But given the resource crunch that our health system has, by the time the people have tested, screened positive, I believe the battle is half lost. Our primary care system is not trained to take care of the primordial prevention part, and in aging, that becomes extremely important. That's about the health sector. Think about the other aspects. If, as we say, people have to remain functional through the life course, if you look at the OECD countries, they have created systems that can take care of it. For example, they have a universal health coverage, which means that over time, you're paying it forward. That is, if you're a young person today, you don't need care, but you don't need that much of care. But the contribution you go is going to pay for the care of the people who need it. But we don't have that system. If you look at one of the best examples of how elderly being taken care of, it is Japan. Their long-term care program, the long-term care insurance, the premium is paid till you are 75, and that is how it is financed. And it's a very comprehensive kind of thing. It is not just a hospital. They're looking at socialization. They're looking at group exercises and so on. And if you go to the parks in China, you'll find groups of elderly doing Tai Chi, huge numbers doing Tai Chi over there. If you look at the Western countries, you will find that the footpaths, the buses, the escalators are all designed to ensure that people remain functional. Sweden will pay for your daily living support so that you can remain in your home. Now, creating that and to say nothing of the financial protection that comes from an universal, near universal health pension scheme. Now, one, the primary care system is not designed to take care of, is not designed to address the primary causes, which is the primordial prevention. Even looking at the bioparameters that you're talking about, I mentioned about the ICOP parameters that WHO talks about. Now, they run the whole gamut, right from the initial screening to taking care of. We have not, I don't think, you can correct me if I'm wrong, I don't think we have an Indian version of the ICOP. It is not even made available. It is not even part of the instructions that we pass out to the primary healthcare people. So this is the healthy aging part. Again, I'm keeping palliative care out. The healthy aging part remains a black box as far as the health system is concerned. And that's happening because aging has not become a policy priority for the government yet, which is also reflected in other areas like nutrition, transport, pensions, etc. So I think you let do a lot more webinars to convince the policymakers to actually flag this issue, and then
No, I think it's very true, and I agree. I think this is a good start, and I hope, like, once this webinar is also available beyond this group and more, we should widely disseminate so people at least start thinking about it. We may not get answered tomorrow, but down the line. So, I mean, there seem to be just so many challenges, both in terms of policy, design, and implementation. So, Pavithra, I just wanted to hear your perspective on. We talk so much about tech and digital health now. Do you think in some way can it bridge any gaps, anything that you have come across, any innovations where you think that sort of, okay, fine, maybe it will help us scale some kind of solutions easily in this space? Over to you.
Yeah, thank you. I would like to first add a little bit to what Rajeev sir was talking about policy. I
Sure,
think
sure. Go
in
ahead.
terms of policy and primary care, if I've talked to some of the ASHA workers and others, and I think they're the most overworked lot in everything that happens. They've been burdened with everything that happens, and they're told you take care of this, A, B, C, D, E. I think the list goes on. So there's no way that they can take care of everything. Second, as policy makers, I don't think they're looking at aging as a complete issue as of now. They're looking at it as still a family issue and only looking at health-based aging related issues because of NCDs, because of other things. But as a whole, I don't think they're looking at aging as an issue. One could be because we still think India is very young. And like Rajeev sir said, we have a long way to go before we become an old nation. But unfortunately, it's no longer true. There was also a statement I was reading, which I try to tell people because one, you have to tell them numbers to make an impact. And I say by 2050, India is going to be old, which will be 340 million people. And as a comparison, it will be our old population will be as big as the American country as a whole. So that's an issue that they think about. Second, according to whatever I was reading, India is going to become old before it becomes rich. If we don't put policies in place to take care of our old. These are realities. We are still talking about India as a young country. They'll figure it out. There is no time to figure out. So how do we make policy holders to realize this? I don't know. Maybe we'll find some way to bring it up. But I think talking about numbers, talking about issues will make it easier. Coming back to technology and what we need to do, one of the things I was surprised by or very interesting to see, I have been working with senior citizens for the last 10, 11 years now. And when I started, nobody was talking about caregiving, the old age or whatever. We were talking about technology and other things. I did a technology innovation 10 years back. I had to close it down within 2 years because nobody was looking at it. But in the last 1.5 years, it's nice to see there are 100 plus people who are working on age tech space. There are a lot of innovations coming up. There are a lot of covering all areas. They're talking about community. They're talking about personal health. They're talking about fall prevention, scientific innovations for dementia, community building, all of those things. But the problem with that is they are only talking about the small paying population who can afford these things. And that percentage is very, very small in India. Even if you take the paying population, if you talk to seniors themselves, they still find issue with paying for their medical needs to be able to take and pay for something else that they think is not a necessity, right? If you talk to the kids, some of them are very interested, but some of them are like, do I really need it for my parents? And it's a reality issue. Maybe they can't afford it for their parents. Maybe they don't think they need to monitor them. They're like, we're all at home. Why can't we do it ourselves? Why do we need another device? So though the innovation is coming in, and I do think these are really required and they do make a difference, especially the fall prevention, if you're looking at long-term care providing that's happening with people who are staying abroad or whatever, even in different cities. If you look at dementia, cognitive abilities that is being trained through these systems, they're really required. But are they affordable? Can they reach the masses? Can policy support, government support? I don't know, but that's something that we need to look at.
Very well said. So it looks like there is need for more human-based solutions than just tech-based solutions, right? And I completely agree with you that tech can be an enabler, but it will only be able to enable if we have an ecosystem in place. So that takes us back to, again, people, which means we need to focus on our societal frameworks, our communities. And as we said in the beginning of the webinar, I'm not here talking about actually senior citizens. I think I'm talking about, let's say, at least from middle age onwards, right? What is it that people should be doing differently so that they are actually able to age in a healthy way, right? So if we say that's the priority for us as a society, then I think it's very contradictory to many things we do, right? Like, in fact, if you look at with more urbanization, we are less active, we have access to all kinds of food, and we are less sort of conscious about what we are eating. And we also are getting more isolated. So if you really look at from every perspective, we are actually not thinking about doing the right things. Let's talk about our age group, like those of us who are in middle age. What is it that we should be doing differently for ourselves? And then comes the question of what you can do for elderly to support them so that they are able to have a better quality of life. So over to you, Rajeev, sir. You have any thoughts about it? The societal change, the community.
I've been arguing that before we turn to the society, we turn even to the family, it's important that people are trained and enabled to remain functional and productive during their uh, young age, old age, whichever age. I mean, right up to the time that you can manage to go on. Because one, I think this whole thing of dependency ratio, by which we mean the productive age group takes care of the non-productive age group. And as a person who is supposed to fall in the non-productive age group, I feel insulted, because I believe that there is no way that the age can depend on and work on, live off the support of the younger population. This is something that the people have to contribute, and I'm not alone in this. Whenever I go to meetings of elderly people, they're all saying, "Look, we would like to contribute. We have had, as Pavithra said, a former general manager has a lot to contribute. Now, create an opportunity for us." Now, my question is that should there be an opportunity? Why, if you are so talented, why don't you try to create that kind of a niche for yourself? It's not easy, because you mentioned about technology. Technology actually is become one of the major threats for the aged people, because they find it very difficult to navigate many of the technologies of today. If you look at the bank frauds that happen through internet banking and all that, a lot of people who are getting swindled are the aged people. Now, that's not going to change. So how do you address it? By ensuring that people are encouraged to understand and make technology part of their support system, and not be threatened by it, and then, if, let us say, you are moving out of a job, you're retiring. Now, shouldn't they get some help in being retrained to take over new responsibilities? can companies develop, like they have in Japan, a system of mentoring by which the people who are senior and who cannot or do not want to work actively on the shop floor can actually mentor other people. So creating systems and change in mindset, first of all, has to happen with, I believe, the individuals themselves. Then it has to happen with the work systems, enabling the elderly I mean, easing them slowly into the new role. And finally, configuring areas where they can contribute and creating opportunities that they can. And as I mentioned before, if you want elderly to come out, if you should make the place space for them. I will not advise elderly people to go on walks on India's footpaths, because the footpaths are so many holes that you will fall there, and you go to a traffic junction, you can't cross. So whereas, as I mentioned before, when you're abroad, things are taken care of. When the bus comes, the bus has the door has a stand that can come down and the wheelchair can be pushed in, and every railway station will have a lift. So that comes from, one, the number of people aging has gone up, a number of aged people have gone up. Two, the systems have been reworked. And I think while we depend on individuals and on families, overall the environment also has to be invested in ensuring that they are able to remain functional. And the benefit is for the whole system, because if they remain functional, if they remain social, their health remains good, they remain productive, and the society benefits. And we don't have to bother so much about the dependency ratio, because they still remain in the working population. Yeah, thank you.
I would like to add on to the same thing,
Sure.
but from the
Yes.
person who's not yet reached the old age state. I keep telling people I'm in this space because I want to make sure that when I am 60, I have the facilities already in place. But I think some of the things that as an individual, people have to look at. One is have a good insurance policy that you continue to take care of as you retire and keep increasing it, because it's become very important that you do have insurance. You can't pay for the health services anymore on your own. Home care systems, because either your parent needs it or somebody needs it. How do you look at it? That's a system that needs to be put more properly in place. There is a system now, but I don't think it is very it's ad hoc at times. So that needs to be comes under policy, standards, everything has to be set. As an individual who's not yet 60, I become a automatic caregiver. What support do I get? What can I implement or put in place so that my elderly parents have support systems? What can I do? What can the systems do in place? Because I'm sure now, because lifespans have increased, that means all of us, our parents will live up to their 80s, 90s, and we will need caregiving support. So what are we going to do for that? Uh, Preventive health is very important. I think one of the things we have to do in, I would say earlier too, but at least from 35 to 55 onwards, get health checks done every 6 months. Keep it as a preventive health thing that happens automatically, because you don't want to be 65 and go then to look at for NCDs, which could have been taken care of in your 30s and 50s, right? I would also suggest people to have a hobby or something to do before they leave their workforce. People always think that after I'm 60, I'll take up reading, I'll take up golfing, or I'll go on a holiday. It sounds good for the first 3 to 6 months. After that, I don't think anybody is interested. If you're not doing it before, you're not going to do it afterwards. So pick up something to do beyond your work, because the first thing you lose at 60 is your work, right? So start, like Sir said, start looking at plans for yourself first. You have to take care of yourself. The government is there, policymakers are there, others are there to help you, but you need to be the primary person to take care of it.
Very well said. Very well said, Pavithra. I loved all your points, and I feel the same way as you. I take care of my parents around 80 and my mother-in-law, so three elderly in our family. And you wonder that, are you well prepared to be there, right? Both as a caregiver, but then it also makes you think, what is that you can do to make sure that you are less of a burden on your loved ones and society as a whole, whether it is healthcare system, whether it is whoever is going to be there to support you. So I think that really takes us to end of this session, and we'll be taking questions. I was also looking through the questions which came, and many of those have been covered, and I'm sure there are more questions here. We'll try to cover that, but I think it takes us to a sort of a perspective that every individual actually need to be sensitized, that they need to prepare for healthy aging. That's what the summary I got. And then we need to, of course, sensitize the employers, the social sort of groups, and of course, policy and health systems, right? So I think there just seem to be this huge task ahead of us, those of us who work in the public health and the policy space, that you really need to work with so many stakeholders to onboard them and make them understand the importance of what can be done at each level. So I think the next steps from what I can see is really defining what individual can do, let's say what families can do, what employers can do, what government can do, what policy, and then trying to see whether there are low-hanging fruits, whether there are things which can be done more easily than others, because there are ones which may require a lot more effort, and there are others which may be easy to implement. And I totally agree with sir, and I think great believer that we need structural intervention in our environment. If we want people to walk, there has to be a safe place to walk. And like my mother-in-law says, yes, there's a very beautiful park, I can go there, but I can't cross the road. So are we really looking at, are we designing our spaces, whether it is, our cities or any spaces, even workplaces, to enable people to stay active? I think I remember reading it from a very senior public health expert. He said that the best medicine for aging we have is actually physical activity. And there's just so much evidence that both in terms of cardiorespiratory, mental health, and your muscles, the overall muscle mass, all of that you can actually address by just doing physical activity. And we just don't have right kind of policies in place to enable physical activity. We want people to walk, but then where should they walk? Preventive screening, I think it's although come into a lot of sort of employer programs and health programs, but I think, I mean, one of the points which came in today's discussion, I agree, is they still look at very sort of, what should I say, quantitative laboratory parameters, but maybe our preventive health or should be more holistic and looking at individual as a whole and giving them not a prescription just to say that, okay, your blood pressure or sugar is high, but also saying, okay, let's say maybe, you don't have adequate muscle mass, and or you don't have, or maybe you are lonely, or maybe you need to develop, as you rightly said, some new hobby. And sir, you should share your experience. Did you develop anything before retirement, or you have started any new hobbies after retirement? So you should share your personal wisdom on that. Yeah, any further thoughts, or otherwise I'll move to the Q&A.
Now, one small issue which
Sure.
Pavithra had mentioned, and Jaya's comment is there in the box.
Sure.
Now, my organization, the one I was working with after retirement from government, had carried
Okay.
out a study of the home health scene in India. It's abysmal. Because I mean, southern states are that way better off. I hope, Jaya, you are in, this, in the southern part of India. The study we did was in and around Delhi, and these are people who provide support for caregivers, in terms of assisted daily living and etc. No standards, no training, no security, both for the workers and so on. And one of the areas I think that we should be working on is trying to standardize it. And in South, we found a lot of lot of investments have been happening surprisingly in and around Coimbatore. In fact, there have been, and Bangalore and Chennai,
Yes.
and Kerala. But caregiving is going to be a major problem, and we need to have standardization of the caregiving of the home care, home health support teams for the future. Yeah, that I want to add at that to the comments.
And your hobby, you didn't tell us.
A hobby is, I've always been a reading aficionado, so I remain with that. And Pavithra, the good thing is that now that I have no commitments, I can travel anywhere I want to, and frankly, you don't get sick of it. I can assure you that.
Yeah.
Yeah. Good for you, sir. You should recover as much as possible.
That's very good to
before I can't travel any longer. That's the aim. Before I can't physically, it's not possible.
Not because physically, it's also safety issue. We don't have enough infrastructure in place for us to travel safely.
Yeah, the other thing you mentioned about insurance. Insurance companies are refusing me cover now. I'm going to take them to IRDA and Ombudsman because I mean people are turning down medical insurance.
Yeah.
I have medical insurance for my in-laws and I'm still not able to cover for the policies because they have limits. And we have been paying for them for like 15, 16 years now.
Yeah.
So I don't know what will help.
I think those are really important policy areas.
We'll fight them. We'll fight them. We're not going to let them get away like that.
Yeah.
So, Anchita, I'm not able to see any questions in Q&A. Can you help me with that? I can see in the chat, someone has put a very important comment. We are 60 plus and we are caregiver of 90 plus. So I think we are really talking about a very different society from what we prepared. And I think it's really important for the caregiver to take care of themselves. And that's where the importance of all the, lifestyle and mental health and so on comes in, and better systems, as you all were saying, for home care. So that's a major policy area we need to work on. Since I can't see any question, I'm going through the questions which we received when the participant registered. And I'm picking the ones which have not been addressed because quite a few questions have actually been addressed. And there is specific question around talking about, India collects extensive data on disease outcome, but very little on functional decline. I wanted to touch upon very important question because we talked about this in the beginning, right? What should be the parameters that we should be measuring either in individuals or at the societal level, and what should we start tracking to enable healthier aging before illness sets in? So I think I'll start by answering this and I will let both of you contribute. I think most important thing, as I mentioned earlier, is I think we should be measuring the overall fitness and not just the blood parameters. And I think in the recent time, there's a lot more data to show that you need to have adequate muscle mass, for example, as one of the very, very important predictors of healthy aging, so that you don't get frail, you have less falls. And the other would be bone health. So muscle mass, bone health, functional decline, especially there are ways to measure the neurocognitive reserve. And there are ways to actually enhance your neurocognitive reserve. So it's not even like we earlier thought it is all irreversible. But I think the research shows that people who remain cognitively more engaged are actually likely to reduce that, say the decline can actually be slowed down and so on. So I think those are the kind of parameters in addition to the usual health checkups which we are aware of. So I will let both of you add on if you think is anything else we should be measuring, both at the individual and the population level.
Lots actually. We didn't talk about the preventive measures. For example, dementia can be delayed by having cognitive exercise. And I think that's something that people need to understand. Even doing normal mathematics should be fine. If you are learning a new language, these have impact on. Second one is fall prevention. There are exercises that are available now to ensure that that you are able to prevent falls in various exercises. And also there are measures that tell you the possibility of the probability of your falls down, like grip strength, walking steadiness, and so on. And slowly programs are coming which actually measures these parameters also. And I think you have many students on this webinar, and I believe we had a question on what matrices to use, and that must have come from a student. Now, I would say if you're looking at it, start from the WHO ICOPE handbook, which lists out the various measures that can be done, and from there are specialized ones like screening for, I mentioned fall prevention, screening for cognitive decline, and so on. So there are lots of measures that are available which have not come into the public health system but are available internationally. They have not been adapted for India, but if you are research students working in this area, I think you should take a good look at them. And I've known research students who are able to modify it for Indian conditions with very successful results. Thank you.
Absolutely. Totally agree.
Yeah,
yeah, please go ahead.
I would like to
Pavithra.
add 2-3 other things, again, not medical, but measure on your active daily activities, daily living activities. Are you able to do all your activities without any problems? Is that decline happening there? Loneliness and connecting to other people. How often do you reach out to people? How often are you talking to others? What kind of community system do you have in place? And I think one of the other things is home safety as such. As you're aging, you've stayed in your home for about 30, 40 years here, you're going to age in the same home. Is that home safe enough for you to age in? Do we have simple standards to say what you should have as you age?
Yeah.
Some simple measures like those that look at your everyday living standards and your everyday aging activities would make a lot of difference for a person. And these are things that they can implement themselves if there are standards and measures present.
Fantastic. I think a lot of important takeaways. And there's one important question which I think I will try to address. The question is that how can our health wellness centers address this prevention aspect, early onset of NCD and functional decline? So I would say that currently our primary healthcare system is really not ready for it. Of course, to NCD to some extent, but I think we need bigger teams, and we need also more structured capacity building of our healthcare workers if they have to address much more complex issues around preventing decline of either we talk about physical, mental, or cognitive abilities. I think currently our systems are not ready for it, so it needs a lot more work. There's also a question around messaging. It talks about, the question is about that how do we reduce stigma so that there is better health seeking for neurocognitive symptoms, because there could also be reluctance in sort of seeking care in the early stage, and then we know that later on we can't do much with maybe early onset dementia, or also just the early symptoms of early cognitive decline, which may go unnoticed, or people may hesitate to seek care. So any experience, Pavithra, you want to share since you work with these populations?
I think in India, what we tend to do or go by is that, oh, he's old, so memory issue is part of it. He's forgetful because he's old. He could be 60, he could be 80, it's the same standard. Once they see gray hair, they say, oh, he's forgetful because he's old. I think that should change to saying that anybody who has memory issues has to be looked into.
Yeah.
And that should become part of every medical standard when you go. You always go for physical health, you never go for mental health. Maybe that's something geriatricians should add in by default. I think they are, but it should be all the other doctors too to look into your cognitive health once they go for a preventive health checkup.
Okay.
Two, I think it's also, I keep coming back to it, but loneliness and isolation. That's a question they should ask. Are you staying alone? Are you able to manage everything alone? Do you do anything when you're alone? Other than watch TV, maybe are you active in anything else? That also will point to your cognitive decline as you go forward, so that you're able to guide them into how they can be more active or do something else, so that the cognitive decline can be addressed at an earlier issue. And yes, prevention is the best way to do all this, but I think this is my pet peeve, okay? I don't like how an old person is shown on TV, cameras, wherever. It's not an old man with a walking stick anymore. He's fragile. He is not in his best cognitive state. He's looking for support from somebody. I think just changing that image will bring a way of how do you look at the whole older person and what help he needs.
Absolutely. I totally agree with you. Can't agree more. Anything you want to add on, sir? What she
I
said.
think one area that we have not touched is how do we involve the community in working with the with on this issue. We must leverage existing institutions. Like there are most states in India now have women's self-help groups, and we found when we were talking to the self-help groups in my panchayat that they are quite sensitive to the. We were of course talking about palliative care, and what we asked them was that if you prepare an individual care plan for the palliative care people, and will you be willing to take part to this thing in your neighborhood by just spending time with them? Will it be possible that can we schedule you for visiting them once in a while? Which that itself is a big help for these people who are alone, especially the palliative care patients who can't move out. And they were quite willing. And they were also quite willing to set up exercise groups. Of course, what they said was that, will you take care of the stray dogs? That's become a major issue. Stray dogs have become a major issue, preventing people exercising. So I think it's, while the health system is important, the other groups like religious groups, pensioners groups, these groups, I think we need to bring them in to see the extent to which they can take care of some of the issues that we have already identified. That's something I forgot to mention in my intervention.
Yeah, I think that's very true. I'm only looking at some of the questions, and there is one comment here. I think I can see a hand raised. Could you
Somebody has
kindly?
raised, yeah.
Yeah, no, I'm just requesting them to post their question here, just to make it easier for us to answer. Mr. Bala, can you please post your question here? I'm reading a comment that has come from earlier posts here. One is that Nobel laureate Dr. Venki Ramakrishnan in his book said that human longevity has increased, but the years gained are often lived with disease. Can we really live without any morbidities into our 70s and 80s? Let me read both the questions and then I think we can answer it together. Preventive health is a wrong term. Are we trying to prevent health? Okay. Please avoid using the term. Correct term should be promoting health, agreed, or proactive health. So I think the preventive care is a pretty standard term used in the health programs. So I understand it can be confusing. Yeah, I agree with you. We should say more of promotive health. But coming back to this question, can you really live into 70s and 80s without morbidities? Now, I think it depends how we define it. So as we go back to our where we began, right? When we look at health in a holistic manner, the idea is, can you reduce the morbidities to as minimal as possible? And can you ensure that the functional decline is slowed down? So people are able to live independently, have minimal burden in terms of, need for hospitalization, healthcare, and also they are able to do most of the tasks themselves. And I think from what we understand from the available literature, at least in countries where we have more sort of, let's say, scientific literature on people living much longer years, we do know that definitely, I mean, at least for a lot of chronic diseases, like, for example, cardiovascular disease, diabetes, and so on, if you delay the onset of these diseases, you are unlikely to have complication in your lifespan. So definitely, you can reduce the risk of getting severe illness for sure. And also depending on, your genes and environment and lifestyle, you could also reduce the onset of disease. But even if you have disease, can you at least ensure that these remain under control to a point that it is not interfering with day-to-day activities? So I will let both of you add on.
Let me explain the word. Generally, we talk about preventive and promotive health. Preventive, we'll look at communicable infectious diseases, looking at things like vector control or drinking water safety and all. So in when we list out health, we say preventive and promotive health. Both have to go together because the promotive part is the more relevant thing in the case of non-communicable disease. The current understanding of functional aging factors in that you could be living with comorbidities, and unless your genes are exceptionally good, it's highly unlikely that you will not be having any morbidity, or even comorbidity, more than one condition. But the challenge, and that's what the other countries are finding out, is just because you have uh, morbidity or a disability, that's not the end of life. The challenge is, how do you make it possible for people with morbidity to continue to be functional? And with lots of therapeutic interventions, medications, assistive devices, these have become possible now. So disabilities, severe morbidity are not the reason to stop living. In fact, it is possible today to continue to be functional and even enjoy life to some extent with these conditions. And there is no reason why that should become the end of life for us.
Yes, Pavithra, anything you want to add on?
Yeah, I agree with what Sir said, but I also add that when you were talking about late into 70s and 80s, can we live a healthy life? You can't start living a healthy life at 70. You should have led a healthy life in your 20s, 30s, 40s. All you can do now is maybe improve your nutrition, maybe work on improving it to a certain extent where you can manage it better. But if you abuse your health till you're 60 and try to prevent it at 61, you suddenly become a health freak. It will help, but it's not going to prevent anything. So
very well said. And I just want to give you example. I think I work a lot on hypertension, and if you look at blood pressure as a problem, because cardiovascular disease is a leading cause of death. So in India, 1/4 of adults die of heart attack or strokes, which is very preventable. The blood pressure medications are cheap, they have minimal side effects, and my own father has been on antihypertensive medication for more than 20 years. I mean, he saw his 80th birthday because of that. So what there are medical interventions, but there are also lifestyle interventions which can ensure that you minimize the impact of the risk factors, and also what we call the diseases uh, at a manageable level. For example, even if you're a hypertensive, you can prevent a heart attack. Even if you are a diabetic, you can prevent a kidney failure. So it's all is not lost. Yes, we do understand that there are certain diseases, and in fact, most of the chronic disease, the risk increases with age, genetics, and of course, all the other risk factors on top of that. But if you're able to minimize at least your modifiable risk factor, what we call them, right, then you can reduce the risk of getting, and even if you get it, you can manage it in a way that it is not impacting the quality of life in a big way. So I think with this note, any final word from both of you, and then we close. Maybe first to Rajeev sir, and then Pavithra, and then I think I'll summarize and close for the day.
My request to the people who are listening in is this is a topic that needs to be highlighted in whichever forum that you are associated with, and it's also a topic in which a lot can be done, and in your own area. So the extent to which, in whichever area you are able to highlight this, and also as researchers, those of you researchers also come up with solutions and testing them out, that also would be useful. So I hope that some of the people who are participating here will carry on working in this area, and good luck to all of you. Thank you. And thank you for having me on this, Prabhdeep.
Pavithra?
I would just say that people shouldn't take aging as a disease. You age from the day you're born. So take it in a more positive outlook of how do you start looking at healthy aging and what are the preventive measures for it, and have a good community to support you through it. So yeah, that's about it.
Thank
And
you so
thank you
much.
for having
And
me here. And thank you, Rajeev sir. It was really nice talking to you again.
Thank you. Thank you.
so I'm so sort of, what should I say? I'm actually having a feeling at the end of this that there's a lot of work to do, but
Yes.
also happy and optimistic that we have solutions out there. So this is not an area that we can do nothing about. There is a lot we can do. And hence, for all of those who are listening out there, please carve out an area where you can contribute either at a societal level or at an academic level or as an employer or as in your workspace. But I think all of us can do something about it. As much as we want policy interventions, we want newer advances to come, but we must remember that as citizens we can also contribute to addressing many challenges around aging. And healthy aging should begin when you are born, and healthy aging should be highlighted, I think, starting from the school curriculum, definitely in college. And I think one of the things I always tell all the parents is, even if your kid is getting a little bit less grades, it's fine. Make sure they are playing, make sure they are eating healthy food. So I think we need to rethink our lives, because it's not like suddenly, as somebody said, at 60 years now I want to do everything right. I'm sorry, the biology doesn't work like that. So you've got to inculcate a concept of uh, healthy living very early if we want to have healthy aging. So that's not going to happen overnight. But also, I think we should leverage the available science, medicine, and technologies to make best use of it, to ensure that even if people who already have certain conditions, they are able to live in the best possible way. And I think ensuring that access is equitable across all levels of society is very important. And hence the role of policy and all the other institutions to enable access to these technologies or medication or resources to everyone, and not just one part of the society. And finally, I really want to thank our Longevity India team, Nikhil, Anchita, and Deepak, and all the other colleagues who have taken this task of, working on this extremely challenging area. In fact, they were the ones to pull me into it. Although I have worked on chronic diseases for most of my career for 2 decades, but I think it's infectious, their optimism, and they believe that we can bring a change. And I'm very sure that together we all can bring a change. So let's end on a positive note. And I request you all to go for a walk today so that you can take your first step towards healthy aging. But make sure, don't cross a dangerous road to do that. So thank you very much. And we'll close with that today. Thank you all.
Thank you. Thank you.
Thank you.